My name's Veronica Holmes. I'm going to be the nurse practitioner student assessing you today.
Hi, Veronica Holmes.
Just going to clean my hands real quick. How are you doing today?
Good.
Great. So I'm going to walk you through everything I'm doing.
Okay.
So first I'm just looking at your head, kind of looking for symmetry. No bumps or lesions or wounds, okay? And I'm just going to feel. Any of this hurt?
Nope, feels
Anything?
really good.
No, feeling for bumps, good. Alright, now I'm just going to palpate your temporal arteries.
What?
Good. Pressing on your sinuses. Any pain?
Nope.
Any pain?
No.
Good. Can you clench your jaw for me? Great. Let me have you smile, frown, puff out your cheeks, raise your eyebrows. Good. Now I'm just going to test your sensation. So, can you feel me touching you here?
Yep.
Does it feel the same on both sides?
Mm-hmm.
Good. You feel me touching you here?
Mm-hmm.
Feel the same on both sides?
Mm-hmm.
Good. Now I'm just going to listen to your temporal arteries with the bell of my stethoscope. Check for any bruits. Good. Alright, now I'm just going to look at your eyes, comparing them for symmetry, any drainage. Feel your ducts up here. Can you look up for me? Good. Looking at your sclera, conjunctiva. Everything looks good. Let me see. Now you can just look straight past me. I'm going to shine this light in your eye. Good. Pupils reactive, equal on both sides. Testing the consensual light reflex. Good. Alright. Now I want you to follow this with your eyes without moving your head. Okay, good. Now I'm going to test for confrontation, so let me know when you can see my fingers.
I can see it.
Okay.
I can see it.
Alright, good. Now we're going to check your visual acuity. So I'm going to hold this about 14 inches from your eyes. Good, and cover your right eye. Or your left eye, that's fine. And let me know the smallest line you can read.
428739.
Okay, now you can switch hands. Cover the other eye.
428739.
Okay, and now with both eyes open, the smallest line you can read.
428739.
Okay, great. Now, let me dim the lights here. Okay, and you can just look at my ear. Still gonna look for your red light reflex. Looking for your optic disc, macula, fovea, retinal arteries. Good. Now I'm going to do the same thing on this other eye. Find the red light reflex. Optic disc, macula, fovea. Alright, good. Turn these lights back on. Alright. Now I'm just going to compare both of your ears for symmetry, drainage, breakdown. Good. Any pain?
Nope.
No? Any pain when I do that?
Mm-mm.
Any pain here?
Mm-mm.
Any pain when I do this?
No.
Okay. So we're going to test your hearing 3 different ways. So the first thing I want you to do is take this finger, put it in this ear. Good. Kind of move it like that so you can't hear me, and I'm going to whisper a word and you just tell me what I say. Baseball.
Baseball.
Okay, good. We're going to do the same thing with this hand.
Hockey.
Okay, good. Now we're going to do the Weber test. So I'm going to place this on top of your head and you're just going to tell me if you hear it more on one side or the other.
Hear it more on this side.
More on that side? Okay. Now we're going to do the rind test. I want you to tell me when you stop hearing this noise.
Down.
Okay.
No.
Same thing on the other side.
No. No.
Okay, good. Last step, I'm going to look in both ears. Alright. So I'm going to pull your ear up and back. Let me know if I'm hurting you. Okay, looking for your cone of light, which I can see. Eardrums are pearly, translucent. Ear bones, okay, good. Same thing on the other side. Looking for your cone of light. Stay peace, okay, great. Alright, and next, let's see, just looking at your nose, comparing it both sides. You can look up for me, I'm just going to look inside. Okay, good. No swelling, no drainage. Can you plug this side of your nose and breathe in for me? Okay, same thing on the other side. Okay, if I had an alcohol swab, I would have you plug that side again, see if you can smell it. Same on the other side. Great. All right. Gonna take a look at your mouth now. All right, so first just looking. Can you open your mouth for me? Good. Hard palate. Lift up your tongue. Soft palate. Good. Touch the tongue to the top of your mouth. Okay, so you stick it out. Move it side to side. Good. Now, open your mouth. Say ah for me. So uvula is midline and it rises. Let me see you swallow. Okay, and open your mouth again. I'm going to test your gag reflex. Okay, good. Sorry. All right. Let's see. So, moving on to your neck. First, just inspecting. Next, feeling your carotid arteries, one at a time. Good. Palpating your trachea. Trachea's midline. Now I'm going to feel your thyroid, so I'm going to step behind you here. And displace it this way, and I just want you to swallow. Okay, good. Let me see. I'm going to feel your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular. Lift your head up. Submental, superficial cervical, deep cervical. Here. Supraclavicular. Alright. Now I'm going to auscultate your carotid arteries. Again with the bell. Good. No prairie. Okay. Can you move your head back and forth for me? Side to side. Good. Raise both your shoulders for me. Good. All right, that's your neck. Now we're gonna look at your chest. So if you wouldn't mind taking your shirt off. My hands are cold. All right. So first, just doing inspection, watching your breathing rate, regular, chest rising and falling, good depth. Same from the back. Gonna check your expansion here. Can you scoot forward on the chair a little? Good. Take a deep breath in. Good. Symmetric expansion. Feeling all your ribs. Any pain?
Nope.
Okay. All your ribs here. Any pain?
Nope.
Great. All right. So now I'm going to ask you to say the word 99 over and over while I feel back here. Okay?
Okay.
Go ahead.
99,
Okay?
99,
Okay?
99,
Your sides here.
99,
Good.
99,
Good. And again from the front.
99,
Okay?
99,
Uh-huh.
99,
Okay?
99.
Great. Just going to take a listen. So if you take some deep breaths for me in through your nose, out through your mouth. All right, now I'm going to listen to your back. Okay, good. Now I'm going to listen to all those lung sounds again, and this time, each time you feel my stethoscope, I want you to say E.
Okay.
All right, go ahead.
E, E, E,
Say it a little longer.
E,
Good.
E, 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 E.
Okay. Now I'm going to listen one more time, and I want you to whisper 1, 2, 3, 4.
Okay.
Okay, great. Now we're just going to check out your heart, so if you can lay down here for me. See, assuming I had you at least a 30-degree angle, I'll have you tilt your head that way. Assessing here for GBV. Don't see any. Good. If you can lean towards your left side, a little towards this way. Gonna feel your PMI. Now listening to all the hard sounds with the diaphragm. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. I'm doing the same thing with the bell. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. Can you lean towards your left again? All right. Sit up for me. Alright. Do aortic, pulmonic, herbs, tricuspid, mitral, and lean forward for me again. Okay, you can sit up. And now with the bell. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, I think that's it.